everyone. I'm Dr. Keerty Nakray, a comparative social policy and public health academic, researcher, and consultant. For my WomenLift Health project, I'm working on adverse childhood experiences among adolescents and resilience during public health emergencies, the role of schools in mitigation in Karnataka. I am the founder of Organization for Research and Education on Social Policy, which bridges the gap between research and real-world impact. Our mission is deeply rooted in evidence-based approaches to achieving United Nations Sustainable Development Goals, focusing on reducing gender inequality and promoting inclusive growth. My current Women Lift Health project draws extensively on my work for the last 2 decades in the field of comparative social policy, gender-based violence, and children and social policy. My leadership project specifically looks at gender-specific impacts of public health emergencies such as extreme heat, droughts, heavy rains, landslides, and COVID-19 on children, and the role of schools and health systems in mitigation. The study of ACE is relatively new in India. Therefore, my study can have a very important impact on measuring prevalence, incidence, and also mitigation in India. My leadership project draws on my recently completed pilot study in one school of Dakshina Kannada, where I validated international tools for measurement of adolescent childhood experiences and also conducted participatory action research with the use of photo voice, diaries, and also worked with parents, children, and teachers on adolescent adverse childhood experiences. So my leadership project builds upon this work. In this particular leadership project, I'll focus on the use of theater, diary, smiley stick-ons, and watercolor pens and brushes to examine ACE. It also includes rapid reviews of existing evidence and also the analysis of structural drivers of adolescent adverse childhood experiences and familial contexts in which we can develop resilience for children. My theory of change is robust and it draws from the intellectual traditions of sociology of childhood, feminism, socio-ecological lens, and childism. Childism specifically refers to the child-centric perspectives on problems rather than the imposition of adult perspectives on children's problems. I also draw extensively from the work of Edward de Bono's Children Solve Problems and also six thinking hats methods. For my leadership project, I have adapted a short story by A.K. Ramanujam called Flowering Tree into a play to draw out the interconnectedness between self, feminism, and environment amongst low-income families and children. The play is also women-centric tale of a central character called Cheluvi. It aims to draw out the sisterhood between nature, health, feminine sexuality, and care. Flowering tree is a metaphor for many concerns, such as menstruation, procreation, and creativity. My project is currently facing delays because of ethical clearance issues and funding concerns. But however, on a positive note, I have collaborated with an NGO called Eco Foundations for Sustainable Alternatives, IFSA, which is driven by the mission to achieve SDG 3, 4, and 5. They currently have included this theater intervention that I have developed for the children in their programs. And also they will in their future programs, they will adapt this work as well. Their work is focused on providing remedial education for 9th and 10th students to prevent dropouts, life skills, mental health, and digital safety trainings, and also improving access to menstrual products and ending child marriage and protecting children from exploitation from practices such as Devdasi, and also combating human trafficking and protecting the rights of children. So my specific intervention was more for research. But however, now it has got embedded in a wider program, which it is at the pilot stage. And I hope in the future I will be able to upscale it to 4 districts of Karnataka and also strengthen my own work strengthen my own work on the role of schools and public health systems in mitigating the impacts of adolescent adverse childhood experiences. In terms of my own personal reflection on my Women Lift Health Leadership Program and what I have learned from it and what I look forward to doing in the future, I feel proud to say that I have walked an extra mile. I've rediscovered my strength as an authentic and a creative leader who walks through challenges and never gives up. And also, I'm acutely aware that my research touches upon the most vulnerable rural and urban communities of India. I've adopted innovative approaches to fundraise, such as walking the marathon, 21 kilometers, though I don't have the most athletic body as well. But for every step I thought of the children of India, and I thought the important contribution that my work will make for these children. I conclude with a poem dedicated to Women Lift Health and the children that I work for. Walk a million miles. I am a woman who broke away the chains. I am the disobedient daughter who broke every rule. I crossed several barriers to freedom. I smile through my tears and I clap for myself as I touch the sky and kiss the moon. Let me be that story for my sisters to hear. I am the one who leads the millions.